Some healthcare facilities are seeing an uptick, though, in cases of RSV. That's a viral infection that can cause serious illnesses in infants, trouble breathing, coughing, and fever. We're seeing reports of a rise in cases across the country. Kent Erdahl with our sister station, Carol Levin, spoke with a doctor who specializes in pediatric and adult infectious diseases.
Is it a little early for this to happen?
Yeah, typically in Minnesota, we see most of our RSV happening December through March is sort of the typical peak seasons.
Dr. Beth Thielen specializes in adult and pediatric infectious diseases at the U of M Medical School and says the rise in RSV hospitalizations in the last 2 weeks already rivals what local ERs were used to seeing at the peak of a winter season prior to the pandemic. And that's just hospitalized cases.
More of the tests that we're doing out in the community are coming back positive, which is telling us that there's probably more RSV out there.
Any reason to believe that this is bad news for the rest of the season, either for RSV or for flu?
Yeah, so we now have a population that hasn't seen much influenza or RSV for a couple of years. And we do know that there's a substantial protection that happens by repeated exposures. So I think people are going to be probably a little bit more vulnerable than they might be during a typical season.
And when you say people, do you mean young kids or do you mean all people?
It's important to make a distinction that RSV causes the most severe disease in young children, but it really does affect the whole population. We do know that RSV causes a substantial amount of severe disease that's underdiagnosed in older adults. And so we definitely see severe disease happening both in the very young and the very old. Get your flu shot, get your COVID boosters. Anything people can do to mitigate the risks for some of the other viruses for which we have treatment is going to be really important for dampening the overall impact of our viral respiratory season this fall and into the winter.
DHEC says that doctors are not required to report cases of RSV, so it is difficult for the agency to say whether we're seeing a statewide increase in individual cases.